Hi, my name's William Clyde. Matt Varacallo's patient. I had knee replacement surgery February 17th,
So 7 weeks ago.
2020. And this is, I'm on 7 weeks right now. I went 15 days off of the cane, and therapy's going great. And the people at Penn Highlands Therapy are really good.
Yeah.
And so is Dr. Varacallo. he did a very good job, and matter of fact, when my therapist, when I was at home, he was telling me that he was seeing 4 or 5 of Dr. Varacallo's patients, and they were the best he's ever seen out of the thing, out of all his patients. So if you're thinking about this, go see Dr. Matt Varacallo.
Give patients how's the time period between 2 and 7 weeks? What's the biggest things you notice in terms of what you're able to do more and more of? Like, what can you tell patients to expect?
My biggest fear when I had the surgery was, how am I going to get up and down the stairs? But I was up and down stairs the very first day. What they showed me at therapy and at the hospital before I left helped me out very much.
What about sleeping? When did sleeping really get easier for you?
Sleeping, when I first had the surgery, my legs would ache some nights, but not where it would disturb my sleep, but they just did ache. But that went away within a couple days.
What's your experience been like? Because you stopped the nicotine pouches, the chewing tobacco before the surgery. Tell patients, how that went for you, coming off it before the surgery.
Okay, I was supposed to quit chewing. I chewed tobacco, but the pouches. Okay, I looked all around town, and I found these pouches that were nicotine free, and I started chewing them, and it kept me off the regular nicotine pouches until I got through the surgery, and I probably didn't go back chewing any regular pouches for probably 5 weeks. I'm not a doctor, but I think the pouches that you put in your mouth, even though it's not a nicotine pouch, it's kind of fooling your mind, saying, hey, there's a pouch in there, we're fine.
Yeah.
So it did help.
Yeah.
And you can get them anywhere.
So you think it's doable? You'd say, like, to your friend that say they had to stop chewing tobacco beforehand, you think it's doable, because coming from somebody who chews yourself, obviously?
Oh yes, I'm 64 years old. I've been chewing snuff since I was 16.
Oh, there you go.
So
You were able to do it.
It worked. It got me through it, and I know it's a very dangerous thing, having the tobacco and having surgery. So I had no choice, but what I did worked.
Yeah. Okay, good. All right.